Hello everybody, my name is John Blanchard with SALTA Direct Primary Care. I'm a family physician here in Michigan, and I'm coming to you from the COVID camper. Today is April 5th, and it's the 13th day in the camper. Let's start with some of the questions that we're getting about COVID. One of the big things that we're getting asked right now, we're having more and more people who are coming down with COVID. We're still on this upswing in Michigan. And they're being managed at home, and there's a lot of questions about, when should I be concerned, when should I go to the emergency room. The really important thing to know here is that if you begin to have worsening symptoms like shortness of breath, you've got to be really in close contact with your primary care provider, so either through phone or video, so that your primary care provider can assess whether you need to stay at home or go into the emergency room. It's also very important for your primary care provider or you to also know your oxygen level, and we recommended trying to get one of those pulse oximeters. Your doctor should have that as well, and your doctor should bring you into the office if their office is open to do an assessment to determine whether your oxygen level is so low that you need to go to the emergency room. One of the things that can happen with this virus is if somebody is generally pretty healthy, the disease can be pretty advanced in the lungs and the person can still look okay, but they're getting pretty far along on the course of the problem. And one of the only ways that you can know how you're doing is to check a pulse oximeter to see what the oxygen level is in the blood. One of the things that can happen with this virus is that a person can go from really holding their own to crashing very quickly. So as we're trying to keep people out of the emergency rooms and out of the hospitals, as primary care doctors, we're really trying to make sure that we're managing people at home, but managing them safely at home. And that means that we've got to be able to sometimes even see you in the office in order to make that assessment or check that oxygen level. So if you've got someone at home that you're managing and they've got the virus and they're starting to get short of breath, make sure you have that connection with a physician so that you can safely manage that person at home. One of the things that I'm grateful for is my wife. We've known each other for 30 years. We met when I was 20 and she was 18. She's a beautiful, intelligent, very strong woman that I love with all of my heart. She holds me accountable to be the best husband that I can be, and I really appreciate that. We realized recently that this is the first time in over 30 years that the two of us have been away from each other this long, and it's difficult, but I've come to really appreciate everything that she's done for me in my life and the times that we've spent together. I don't think when we were still that young when we first met that we would be going through something like this together, but I'm glad that she's in my life to go through this with. And that's the thing that I hope that comes out of this, is that all of us in our marriages, that we begin to appreciate our spouses. Sometimes we don't appreciate them as much as we should. And living in the COVID camper, I can tell you I've really come to appreciate my wife. I've been doing the cooking and the shopping and cleaning the camper and all of these things that my wife fortunately has been able to do at home and helping in raising the kids and taking care of the meals and the cleaning and all of those things that are so important. And I realize how much time that takes, and I really appreciate it. And I think one of the things that, again, I hope comes out of this is that we all in our marriages, our spouses, we recognize that unconditional love is true love. And it's the kind of love that we feel for our children. It's the kind of love that we felt from our parents. It's something that is precious. It's something that's rare. And when you have it in a marriage, it's worth fighting for, it's worth appreciating, and it's worth holding on to. Probably the most important thing in life is unconditional love between a husband and wife. And this is one thing that I'm really coming to appreciate through this crisis, and I hope that everybody does in their marriages as well. The one thing I like about being a direct primary care doctor is that it allows me to spend more time with my patients to research their problems, to understand their problems, and manage their problems. I think in today's healthcare system, unfortunately, because the primary care doctor often doesn't have enough time with their patients, they turn to being just a place where referrals happen. So I don't know if you've ever had this experience where you go to the primary care doctor and next thing you know, you've got to see 3 or 4 different doctors. And certainly referrals to subspecialists are important for when they're needed, but I think too often specialty referrals are made too frequently, and it's because primary care doctors in the traditional healthcare system haven't had the time to be able to spend on managing their patients and taking the time to arrive at diagnoses and management in a larger degree than we are able to in direct primary care. So that's one of the things I really love about being a direct primary care doctor. And in fact, we're able to manage primarily more of our patients and reduce unnecessary referrals to specialists by up to 30%. So it's a really good model for that. And patients appreciate it too because it saves them time, it saves them money, especially if they have high deductible plans. So if you want to learn more about direct primary care or SALTA direct primary care, you can follow us on Facebook, facebook.com/SALTA of Clarkston or facebook.com/SALTA of Troy. We have 6 locations. We take care of 8,000 patients here in Southeast Michigan. You can also call Kyle at 248-922-3076, and he can explain how the direct primary care model works, and you can decide if a direct primary care can work for you. Thanks again. Stay safe, love each other, and we'll see you again tomorrow.